Hello, everyone. Welcome to Mind Over Chatter, our mental health podcast hosted by NAMI, Lorain County. My name is Tennille Power. I am the proud executive director of NAMI, Lorain County. And I am excited that we have a host joining us today, the Nicole McKinney-Johnson, who is president and CEO of Cleveland Rape Crisis Center. I will pass the baton to her so she can introduce herself formally and speak of the wonderful work that they are doing there.
Well, thank you, Madam CEO. It is a privilege and an honor to be here today. Thank you for allowing Cleveland Rape Crisis Center to be topic of conversation. Also, thank you for serving on the board at Cleveland Rape Crisis Center. It's a joy to have you with us in this fight. Cleveland Rape Crisis Center has been in existence for 52 years. I am the first Black woman and also former board member of Cleveland Rape Crisis Center to be in this position in their 51-year history. Cleveland Rape Crisis Center, our mission is to support survivors of rape, sexual abuse, promote healing and prevention. That is our charge every single day. And we believe that our survivors need to be believed the first time. And that is really where we start. We serve anyone and everyone who has been impacted, regardless of how long it's been. The average caller that we get, the occurrence is between 10 to 15 years ago, because we have been unfortunately conditioned that sometimes in these areas, it's our fault or we ask for certain things. And we know that is not true. And this is also impacted by mental awareness and healing. And so at Cleveland Rape Crisis Center, people of all ages, demographics, financial background, zip codes, we are all affected every single day. I tell people all the time that everyone is a survivor of something. And unfortunately, the common denominator is sometimes sexual assault. And so we lean into that every single day as well. We have several locations. We are in 10 regional offices. We serve Cuyahoga, Lake, Geauga, and Ashtabula counties. One of the things that we understood in this movement is that everyone does not want to pick up a phone and call us. So we have text to chat where people can talk with a licensed, trained professional, just to be believed and start telling their story and, give them the tools that they need in order to get on this road to healing and whatever that healing looks like. We don't want to quantify it with just therapy or education and outreach. Let's just start with your story and go from there. My trajectory into this role is very uncommon. My background is over 30 years in HR. I've served everything from higher education to government to private, Fortune 500 companies. My last land, I was a chief people officer for a construction and a cannabis organization. So you talk about tomato, two Black women who are leading the forefront in those two industries. And I was blessed to be their chief people officer. And serving on the board here at Cleveland Rape Crisis Center, when the former CEO was stepping down, they asked me to step in to lead the transition committee. And I did that. And so we, in all true fashion, got a firm to secure some candidates. We landed on the last one. She was ideal. She interviewed, great. And the final question she asked of us is, why are you on the board of CRCC? I don't remember what I said, but it must have landed because on that Monday, she sent the most beautiful thank you, no thank you email, because the industry and what we do, it was a heavy lift. And she just was not, she didn't feel like she would give the role what it needed. But in the conclusion of the email, she said, Nicole, I believe, don't know where you're at. She says, but I believe you would be the perfect CEO for this organization. Your heart, your intent, your story, they need to have you in this seat. Well, I was a deer in headlight, as you can imagine. I wasn't even thinking about it. And I am a true woman of faith. And I know that God doesn't do anything out of order concerning his children. And I am also a survivor of rape, not once, but twice. And so for me, this was a full circle moment where it answered some questions and as it relates to the direction that I needed to go. And for me, this work is not that, it's mission. And it's ensuring that we have a platform and a space where people can tell their story and be healed. As you mentioned in the introduction, this is Mental Health Awareness Month. And what better vehicle we can use as agencies to combine and integrate, these traumatic things that are happening to people. And once, we start to unfold and unravel and peel back the onion, they're all connected. And so this has been our challenge and our commitment to the survivors that we serve.
Indeed. Thank you. Thank you, Nicole. Thank you for sharing your story.
Absolutely.
First and foremost. And it truly is a privilege and an honor to serve on the board of the Cleveland Rape Crisis Center. My background is 20 years, over 20 years in nonprofit work, and I cut my teeth in sexual assault services. So it is all interconnected. Um, and what we have to be careful of though, because we both at NAMI we believe in a peer support system.
Yes.
Where we walk with people in their journey, we empower those who are currently living with mental health challenges, mental illness, to really talk with once they are in a place that they can be
Right.
talk with and walk with their peers. We believe in that. As we believe in the community, and I
Yes.
think both sexual assault, domestic violence, mental health, they all dependent upon community, and
Yes.
people become victims when when that community is taken away.
That's
You
right.
know? And
Mm-hmm.
the perpetuation of certain stigmas, create even more isolation, within
Absolutely. And
community.
we have found also, at the Cleveland Rape Crisis Center, is that we have case managers and we have advocates that walk, to your point, through this journey with them, whether they choose to go through the legalities, whether they want to have, you know, um, therapy, if they want to, um, seek additional partnerships with other agencies. We work collaboratively because we know that when people are going through something, it becomes siloed and they don't feel that no one understands and I'm the only one that's going through this. And to have trauma informed people working with them as they are unraveling their own trauma to them, they can then say, let's make a reach to NAMI. Let's make a reach to, if it's small children involved, let's make our reach to Canopy. And, this is my first land as it relates to an executive space in nonprofit. I've always been for profit. And so I am learning that it is a community, but it's still siloed to a point. And having new leadership, change of regime, bringing in the different things that we've learned outside of the circles that we are in, it helps, it benefits. Because at one point in time, agencies didn't collaborate and they didn't talk about it and didn't share resources, because everyone's pulling from the same grant buckets. And what I've learned in this space is better to share so that we can get to a common denominator of what we're really here for, get to the why, which is our clients, our survivors, those who need us most. So I totally agree.
Indeed, indeed. The tapestry is so interwoven
Mm-hmm.
so tightly,
Yeah.
because what I remember experiencing, both as a survivor as well and working in the field,
Mm-hmm.
depression onsets because of the trauma,
That's right.
which then leads to mental health challenges, right?
Mm-hmm.
So
Mm-hmm.
we can't, yeah, we have to stop working in a silo. I'm trying to figure out a way to get you all out to Lorain County because
Please and thank you. Vice versa. Yes.
we need it.
Yes.
Mm.
Yes.
And it's that interwovenness that brings us to the conversation I wanted to have with you. As you are well aware, about mid-April,
Mm-hmm.
it hit, social media networks about 7 African American women who were murdered And then subsequently there was a homicide. So a homicide suicide, or I would actually, yeah, homicide suicide, by African American women by their partners.
Mm-hmm.
And there are a few. One that definitely obviously hit the internet heavily was Serena Fairfax, who was the renowned dentist on her own,
Yes.
professional on her own,
Yes.
murdered by her husband, who was the former, I believe, mayor of Baltimore,
Mm-hmm.
former mayor. And all of a sudden there's this, and he was a member of a renowned fraternity, and how Roland
Mm-hmm.
Martin went on, and 1,000 people have done podcasts around the
Sure.
op-eds.
Yeah.
What I've seen, which has been seen and read, which has been very disturbing, is this almost default of, well, the perpetrators, the murderers, because I believe in language, so we're gonna name them
Right.
what they are,
Yes.
they suffered with mental illness.
Mm-hmm.
And I'm like,
Yeah.
that's dangerous.
Mm-hmm.
One, we're doing injustice to the victim, because is there something wrong? Yes,
Right. Right.
but we go down a dangerous rabbit hole because there's already stigma with persons living with any type of mental health challenge. So all of a sudden now, oh my God, if he was mentally ill and murdered, the mentally ill people are murderers. It's very
Correct.
easy, to
Right.
make those connections. But so I wanted to have a conversation around how we have to debunk that,
Yes.
and 10 toes down, flat-footed.
Mm-hmm.
No, he
Yeah.
was not. And I intentionally take out the Fairfax or spotlight
Sure.
this particular case because he was accused of sexual violence,
Right.
prior to
Multiple times.
multiple times,
Mm-hmm. Mm-hmm.
and how we can't use mental illness as this defunct de facto,
Mm-hmm.
excuse,
Right.
for
Right.
violence, and particularly violence against women. And I want to say between her, I know a few others, and definitely another one that brings to mind is the mass murder and shooting from in Louisiana,
Yes.
where the mothers are still alive, their
Yes.
children are not, you
That's right.
know, and
Right. Right.
what are your thoughts? Where is this landing with you working in that circle, your circle
Sure.
world?
So it's a lot of complexities and a lot of layers to this thing because to my understanding, both of the two gentlemen, that you referenced, had substance abuse
Mm-hmm.
issues also, right? That were documented. And this sexual assault, when you're under the influence, people tend to think that's a justification of what they did. And
Right.
so they look at that differently also. And that has been the biggest misconception and the pause for those who have been sexually assaulted to go to the authorities because you feel like you're the person that's on trial as
Mm-hmm.
opposed to the person that needs to be helped.
Yeah.
So, case in point, you go out to dinner and you have a few glasses of wine and you go back to said person's home and you decide that you don't want to have sexual relations and this person takes advantage of you. And it's all about power. Doesn't matter if you had, drinks or not, but when you go to report said crime,
Yeah.
that's the first thing they ask you. Had you been drinking? Where were you at? What did you do? What did you wear? Right? And all of those things doesn't mean anything
It-
to the person who has been assaulted, right? And so that is also to your point, one of the most misconceptions as it relates to sexual assault. It has nothing to do with the exterior
Nope.
or what you did or what you said. It's about power.
Yep.
And unfortunately, I have to throw in this too. We always go to the side of the male being the assaulter, the
Mm-hmm.
person who does the crime. There's women that do this as well.
Oh, yeah.
And what space does a man feel comfortable telling a
Yeah.
stranger or his tribe or his frat that he was sexually assaulted by a woman?
Yeah.
Right? or those that are in same-sex relationships. It is so hard. It is so many layers
Yeah.
that you really don't know where to start. And so what I and what you are doing is providing, I say all the time, having uncomfortable conversations in comfortable spaces,
Yeah.
because we have to start talking about this thing, because then it makes people feel that they have a voice and that they can tell their side of the story. I am not here to defend anyone.
Mhm.
All I know is that when you are under the influence of anything that you put into your body that makes you change behaviors and the way that you think, the result never comes out the best.
Mhm.
And to my understanding, it was documented that these people were under the influence for several years. They were not treated, um, and you know, filed the necessary paperwork and did all the right things, and then this is still the outcome.
Yeah.
And where do where do where does this land for people? You
Mhm.
know, they tend to stay in the relationship. They
Yeah.
tend to stay in the house. They tend to just, you know, what's the word? Just pack it down,
Yeah.
put their head down and just keep doing the work. And so um, it's unfortunate that we keep having this conversation,
Yeah.
because they were doing the right thing. These mothers, you know, answered the call to this dad who wanted to see their children,
Yeah.
and they made it happen. And then this is the outcome of that, right? And so, you know, how do they then rest in knowing, you know, that they were just adhering to their children's father?
Yeah. Yeah.
Yeah, yeah.
Something you brought up, which is so pertinent to know in both of our worlds, when a person who is experiencing domestic violence has
Mhm.
made an intentional decision, which is not easy,
Correct.
part of it, and not easy to say you want to leave for multiple reasons. One,
Mhm.
you love the offender.
Yes.
There you had a relationship. No one comes out the gate, hey,
Correct.
I'm gonna rape and beat you today. No one does that,
Right.
right?
Right.
This comes over time where trust is built, where love is built,
Yes.
where
Yes.
boundaries are down. These people were, particularly Serena, she was married to her husband,
Yes.
for multiple
Yes.
years. So once you make a decision to leave, it the likelihood of you being killed is quadrupled at that point.
Yeah.
Because the perpetrator does not want to lose that power.
Mm-hmm.
And
Mm-hmm.
so, and this is where these women's stories just land so heavily, getting
Mm-hmm.
on the back end, right?
Yes.
Because the
Yes.
crime has been committed, it's been horrendous, and particularly for these two, it was committed in front of their children or within vicinity of their children.
Yes. Yes.
Which makes me, as a footnote, like, can someone please reach out to those babies?
That's right.
Because
That's
we are
right.
going to have 1 to 2 generations of
Mm-hmm.
children and young
Mm-hmm.
adults witnessing violence at firsthand, right there, of
Right
their
there.
parents, being killed.
Right. Right.
But then, so we have a murder now, and then a
Mm-hmm.
suicide, a death by suicide. And
Mm-hmm.
now we have to find an excuse.
Yeah.
That's what I think it is. It's an excuse. There's no logic behind this. We want to have to put it in a box
Mm-hmm.
I wonder if almost to make ourselves feel safe,
Mm-hmm.
because
Mm-hmm.
if, oh my gosh, he was a dentist and he was a politician and, oh my God,
Sure.
if it can
Right.
happen to them, because we forget mental health and sexual assault have no bounds, no socioeconomic bounds, no
No.
cultural bounds. It happens anywhere and in all spaces, and so
Mm-hmm.
we
Mm-hmm.
have to find this excuse,
Yeah.
as to why
Mm-hmm.
they did it, instead of
Mm-hmm.
just naming, the
It's what
evil
it
that
is.
it is. Right.
Right.
Name it what it
Right.
is. This was
Mm-hmm.
not a case of mental illness. This was not a case of
Mm-hmm.
mental health gone bad. There are
Right.
plenty of people who are living with mental health, from everything from ADHD to depression to postmenopause,
Mm-hmm. Right.
perimenopause, all the
Right.
way through disorganized,
Mhm.
schizophrenia, they're not violent.
Right.
They are not
Right.
committing vicious, violent, intentional, angry crimes, And
That's
so
right.
we have
Mm-hmm.
to stop, we have to interrupt. I love what you say, having uncomfortable conversations in comfortable spaces.
That's
Yes.
right. That's right.
We
Yeah.
have to do, we have, this is what being a violence interrupter is, because that
Mm-hmm.
is violent to even put that out there, on social
Mm-hmm.
media, on what, I don't care if you got 4 followers or 40,000 or 40 million,
Mm-hmm. Mm-hmm.
we
Mm-hmm.
have to be careful of the narrative that we put out there.
You're 1,000% correct. And, just even speaking from the side of, sexual assault, the average time a person has to tell their story is 17.
Yep. Yep.
17 times this person has to talk to the authorities, to the hospital, to their family, to the court systems. And
Yep.
after a while,
Mm.
they either have the decision to move forward or just to stop because
Yep.
it's exhausting and there's no support in all of the spaces.
Yeah.
We have so many people who, you know, start out on this journey to get justification or get, justice served,
Hmm.
and they lose their momentum because then it's attached to so many other things that they can't control.
Yeah.
And we have a lot of um, sexual assault cases that happen from domestic violence
Hmm.
that stem from, we even have a rising number in married couples where they're in, to your point, from the exterior, they're in healthy relationships, you
Hmm.
know, but one thing I will say about social media, because you can use it for good or bad. The good side of social media, it allows people to hear other stories and they can then attach themselves to that and say, okay, I talk about all the time, the Epstein files and the Sean Combs, right? Where people are looking at this and hearing this, and they are equating their own personal journey and saying, I didn't even realize I was being sexually assaulted, or I didn't realize this was human trafficking. We're in Cuyahoga County. We are the third largest city in Cleveland to have human trafficking access because of all of the highway access that we have. 3 weeks ago, we just retrieved 9 women and 6 children right
Hmm.
here in Cuyahoga County that were being trafficked by someone out of Indianapolis,
Okay.
right? And so I was having another conversation with a woman who said, well, this doesn't happen in my neighborhood. I let her know that we had a woman accosted in Cracker Park a month
Hmm.
ago. So we can't assume anything. And by all accounts, I am sure you talk to the families of these women
Yeah.
who are no longer here. They did the right thing, or they told their story, or they filed those police reports. And to your point, equate mental illness with that is totally not true.
Yeah.
And they take the medication, they get the therapy that they need, just like we all working ourselves through. But to put this as a mental illness without accountability
Yeah.
is unacceptable.
Indeed. Indeed. I agree. And I have
Mhm.
so enjoyed this conversation.
Thank you.
Much needed. And we're going to
Hmm.
keep fighting to do the work. I think at all levels, all circles of social service, I think in the back of our mind, we're like, we're going to work ourselves out of a job one day.
Yeah.
Hopefully, maybe we will. Yeah.
I tell people all the time, I wish I didn't have to be here and I don't have the privilege to close my doors.
That's right. That's right.
But what we can, again, thank you for this opportunity, is to continue to collaborate and
Absolutely.
lean in and, not avoid communities. We've been asked, what's said in the house stays in the house, and you pray it away. Well, God make prayer and therapy. And
That's right.
so So let's lean into that, and at the next family function, let's really talk about some uncomfortable conversations in comfortable rooms and let people that we love dear, let them know that there are resources that are free that they can adhere to without judgment.
Indeed. Speaking of resources, before we leave,
Yes.
can you share any hotline numbers, any events that you have coming up?
Absolutely. So we can be reached at clevelandrapecrisis.org. We have a fundraiser coming up in September. We just had one. As you know, Sexual Assault Awareness Month was literally 4 days events entire month of April. My team, they are still trying to dig themselves out. But we had an amazing awareness and ensuring that our communities know that we're here and we exist was what is our focus, the month of April, but every day, all day, sexual assault is top of mind for us. Our call to text is 216-619-6192 or 440-423-2020. But anything that you want to find is on our website, clevelandrapecrisis.org.
Oh, wonderful.
Numbers.
Thank you. Thank you. And for
Thank you.
those that are in search of mental health resources, you can always, we always defer to 988. Please call them. That's our national mental health awareness hotline, and they will connect you directly to us. But our direct number is 440-240-8477. And you can find us on the web at NAMI, NAMI-LC.org. And this is our month, Mental Health Awareness Month, and you can
Yes.
find us at 1,000 health fairs. They'll all be listed on our website shortly. And we do pop-ups, and call us anytime if you want to bring us in to have conversation. Anything from conversations to workshops. We do Basics 101. And I know Cleveland Rape Crisis Center has an amazing prevention education team that will come out
Yes.
and teach the dynamics on sexual assault and sexual violence. So for next time, Mind Over Chatter, reach out. We are here, and thank you for tuning in.